Hi guys, welcome back to my channel and welcome to anyone who is new here. My name is Antenatal and I am a registered South African nurse and I'm here on YouTube to document my life as a nurse in South Africa. If that is the type of content you would enjoy, please do hit the subscribe button and join This Is Nasty. So without wasting any time guys, let us get into today's video. Okay, honestly speaking, I would have loved to wear my uniform, like to have my distinguishing devices, my epaulets on. However, I no longer wear epaulets at my current job, so I don't purchase epaulets anymore, and the ones I have, they look so shady. But I made notes, I've created notes because I want to make sure that I give out all the information that is necessary. So every now and then I'm going to be glancing on my diary. The information that I am sharing here comes from the National Consolidated Guideline, so it is reliable information. I did not just go into the internet and searched. I used the South African National Guideline. This is the consolidated guideline that is currently being used to manage and to treat and also to diagnose HIV in South Africa for adolescents, children and adults as well as infants. So all the information that I have comes from here, and some of course will be coming from the experience that I have. Today's video is about HIV in pregnancy. So I am here to talk to the women who are living with HIV. Whether you know it or you don't know it, whether you are on treatment already or you're not on treatment, this video is for you. Women who are intending to conceive or women who have recently just found out that they are pregnant. This video is for you because we're going to talk HIV in pregnancy. So what are the most important things when it comes to HIV and pregnancy? Number one is to ensure that the mother does not die because of HIV during pregnancy. Secondly is to ensure that the baby that the mother is carrying does not get infected with HIV. It is said that HIV remains the third disease in South Africa to be causing maternal mortality. It's also said that HIV transmission from mother to child contributes greatly to the death of under 5 in the country. So HIV prevention is still very much necessary during pregnancy. We need to do away with the mentality that everybody knows about HIV. Nobody needs to be told that they should be taking their treatment. If it still remains the third in the country to be causing maternal mortality, then that says there is still lack of information somewhere, somehow. And I hope this video will also play its part in reducing the statistics of maternal mortality due to HIV. In 2015 January, the Department of Health in South Africa declared that every single pregnant woman should be started on ART. Let me use the word ART, which is antiretroviral therapy. So if you are pregnant, it doesn't matter how far you are in terms of your pregnancy, regardless of CD4 count and regardless of clinical staging. So clinical staging is basically the disease progression. I'm going to share important factors that I think women should consider if they are planning to fall pregnant or if they've just discovered that they are pregnant and they are also HIV positive or they are living with HIV or have been living with HIV really. Number one, it's couples counseling, you guys. Couples counseling doesn't only happen when you are going to get tested with your partner, but it is important if you guys are trying to conceive together. Whether the partner is HIV negative or HIV positive, couples counseling before conceiving or during the early conception stage, it's very important. This is where you sit down with your healthcare worker and you discuss your plans, you ask questions, and you let your healthcare worker give their own opinion. They also address your concerns. They also address your questions. This is where you get an opportunity to ask questions. You get an opportunity to be educated. These are the things that you need to discuss with your healthcare worker. You need to discuss your blood results, and with your blood results we are taking your CD4 count. You also need to discuss your viral load, like your CD4 count, like your your immune system, basically, the strength of your immune system in a layman's language. But you need to discuss your CD4 count, if you are healthy enough to carry the pregnancy without complications or without transmission. You need to discuss your viral load levels. Viral load is the amount of virus that is within your blood. The higher the amount of virus in your blood, the higher the chances of you transmitting it to your child. I mean, we all want to give birth to children who are HIV negative. We are all striving for an HIV-free generation. So these are the things that you need to discuss with your doctor: your CD4 count, as well as your viral load, and the chances of other opportunistic infections, or even the screening of other opportunistic infections. Like your doctor or your nurse needs to screen you for syphilis, for gonorrhea, like those are sexually transmitted infections that can cause harm to the baby. You need to be screened for TB, you need to be screened for meningitis. So if you guys are planning to have a child, it is advisable to go for couples counseling, and in that couples counseling, these are the things that you need to discuss with your doctor: your viral load, your CD4 count, other opportunistic infections such as TB, meningitis, syphilis and gonorrhea, like your sexual transmitted infections. Those are the things that you need to discuss with your doctor. And also, obviously, like other methods of ensuring that you continue to have low viral load during the period of trying to have a baby. If you are living with the HIV as the woman and your partner is HIV negative, then the things that should be discussed during the period of couples counseling include HIV prevention between you and your partner. At the end of the day, you don't want to infect your partner, so things like PrEP will be discussed and suggested to your partner if your partner is HIV negative, and things like your viral load needs to be discussed because you're the one who's going to be carrying the baby. Things like your CD4 count needs to be checked out and discussed because you need a strong immune system to carry a child and do not have any complications during that pregnancy. And even if your partner is the one that is HIV positive, really, you still need to go together and have couples counseling where PrEP will be an option for you as the woman who wants to conceive. So PrEP is actually pregnancy friendly. It can be taken during pregnancy and during the period where you are trying to conceive. So if you are HIV negative and your partner is HIV positive, as the woman you are eligible to take PrEP. It will assist you not to get infected during the period of trying to have a baby. And obviously, as soon as you catch, as soon as you've conceived, then you will have to use things like condom to continue prevention of HIV infection. The other thing that you need to start when you are planning to conceive or at the onset of your pregnancy is folates, your folic acid, your calciums, your supplements, basically, just to ensure that your body is going to be strong enough and have enough nutrients to supply you and the baby. And now we move to the second stage, which is the stage of trying for the baby. So during the period of trying for the baby, whether you both are HIV positive or the other one is HIV negative, obviously you're not going to use a condom after that. This is after you've had the couples counseling with your healthcare worker, right? You then need to now go and try out for the baby, right? You get a thumbs up or a green tick from your healthcare worker to say you guys are ready for conception. You're not going to do what we call timed, limited, peri-ovulatory sex without a condom. This means that you are going to monitor your cycle as a woman, and you're going to know when is ovulation, and during the period of ovulation you're going to have unprotected sex. That's what it means. It means during the time of ovulating as a woman, you and your partner are going to have unprotected sex. And from the information that you would have gotten during couples testing, you will have to practice and implement strategies and methods that will ensure viral load suppression. Viral load suppression means the level of HIV in your blood needs to be lower than detectable limit, okay? In that way, it ensures that there's not going to be cross-infection between you and your partner during the time where you are having unprotected sex. And most importantly, there's not going to be a transmission of the virus to the baby. What is cross-infection? Cross-infection is me as Zanele being HIV positive and my partner being HIV positive, and we both have unprotected sex when our viruses are high, like when our viral loads are high. It means I'm going to give my partner my virus and he's also going to give me his virus. That's why when a person or a woman or a man is lower than detectable limit, like the virus is lower than detectable limit in their bloods, and they start having unprotected sex with someone whose viral load is high, this person whose viral load is lower than detectable limit will eventually go up as well. It will elevate because he will be getting new virus from the person whose viral load is not suppressed. So that is why we are saying have timed or limited or peri-ovulatory sex without a condom, because really a lot of things can disturb the viral load, you guys. Another important factor that I think I need to say out there about couples going for consultations together, it's because things like male circumcisions are discussed, guys, during the antenatal clinics. And as a woman, often we answer on behalf of our partners, and I don't think that is fair. And at times it is very difficult for the woman to relay the information that they got from the clinic to the husband or to the boyfriend or the partner when they get back at home. So it's important as a man to always be there for clinic visit and doctor's visit, because there are certain things that we share as healthcare workers that pertains to you as a man. Things such as male circumcision. I mean, if you both go to the couples counseling before conceiving, then the doctor can advise you as a male, if you are not circumcised, to get circumcised, you know. So I highly recommend couples counseling, okay? Now you've had your timed, limited, peri-ovulatory sex without a condom, and you finally conceived, and you do your pregnancy test and you realize that you are pregnant. It is important, guys, not to delay going to the clinic or going to your doctor for antenatal care. It is very, very important. And I know a lot of us like delaying the process of going to the clinic because you feel you're gonna have like a lot of visits to attend to, and delay it until the 4th month or the 5th month, and that's the only time a person goes to the clinic. Guys, that mentality needs to come to an end. That needs to come to an end, and not only for people who are living with HIV, but also for everyone else. Guys, early booking assists us as healthcare workers to early detect any abnormalities that you might be having during pregnancy. It helps us to identify like high risk cases, and the better identification or detection of high risk problems during pregnancy, the greater chances for management to be successful. So if we're going to detect hypertension or diabetes mellitus during your pregnancy, the earlier we detect them during the early pregnancy, the better, because it might cost you your life and it might cost you your child's life. So let us stop delaying going to the clinic for antenatal care, you guys. We need to stop doing that. In the primary healthcare sector, we recommend early booking as early as 6 weeks. When you discover that you're 6 weeks pregnant, 4 weeks pregnant, please go and have your first appointment. And once you've conceived, now we highly recommend consistently use condoms, okay? Like I said, that there are so many things that can disturb a person's viral load, so we do not want you to catch or transmit the infection to your partner, or your partner transmitting the infections to you and you transmitting it to the baby. So after you've conceived, we highly recommend the consistent use of condoms, okay? There are things that are going to be done to you on your first visit, and one being you're going to be tested for hepatitis B, you're going to be tested for syphilis. Please do Google those diseases that I'm mentioning, or those conditions I'm mentioning now. Hepatitis B affects the liver, and then syphilis is a danger to your child because it can affect your child's eyesight. So at first visit, whether you are pregnant, whether you are HIV positive or not, you're going to be tested for syphilis. But it helps to test syphilis prior conceiving, okay? So if you do your couples counseling and you go and see your doctor, you need to speak about screening or testing for syphilis before you even try out for the baby. But at your first visit, it's so important. This is why it's even important to go earlier, so that if these conditions are detected, they can be treated, right? So at first visit, you're going to be tested for syphilis, you're going to be tested for things like hepatitis B. If you are living with HIV, you're going to be tested for like TB, screened for TB. If you have TB, you're going to be treated. If you don't have TB, you're going to be given prophylaxis, TB prophylaxis, if you've never had it in your life before. So it's very, very important. And if you're not HIV, if you're not living with HIV, or your partner is the one that is HIV positive and you are HIV negative as the woman, at first visit you're going to be tested for HIV, obviously. And actually in every single visit, every pregnant woman gets tested now in South Africa. That's what the guideline says. Well, we offer you the test, okay? So at first visit, as someone who is HIV negative, you're going to be offered an HIV test. You're going to be tested for syphilis, and you're going to be tested for RH, I think it's called rhesus factor. That's what you're going to be tested for. And then you're going to be educated as well on other infections that you can get, like prevention of sexual transmitted infections during pregnancy. You're going to be educated on all of that. And then if you are living with HIV, you're going to be tested for your viral load. Like, we're going to check the level of the virus in your blood. And we're also going to check your CD4 count, how strong is your immune system. We're going to check if you don't have hepatitis B. We're also going to check you for other sexual transmitted infections such as gonorrhea and syphilis. We're also going to screen you for TB. If your CD4 count is low, we're going to check you for meningitis. So this is for people who are living with HIV, be it you are a known HIV client or you are a newly diagnosed. And if your viral load is lower than 50 copies per mil, we're going to check the viral load again when you are delivering, okay? Like, we're going to check it, they check it at first visit, and then they also check it at delivery. So throughout the pregnancy, throughout the 9 months of the pregnancy, you're not going to do any viral load tests if the viral load is less than 50 copies, if it's lower than detectable limit. But if it is not less than 50 copies, then we're going to be monitoring it per interval according to the guidelines. We also check your kidneys if they are in good condition. So we will check your renal functioning by taking creatinine levels, like checking your creatinine levels. Now, during pregnancy, I still recommend that the fathers, like the baby daddies, about daddy to be, about father to be, I still recommend that they do accompany pregnant women to the clinics, because this is where things like infant feeding are being discussed. And if you are living with HIV, or especially as a mother, because if you are living with HIV as a mother, it means your child is exposed to HIV. That means that at birth there are certain medications that will be introduced to you as a mom that you need to give to baby. I'm going to do a complete separate video about that right after this particular video. I'm going to do a video on HIV in breastfeeding or HIV after delivery. So as a dad, you also get to have a say on what you think is best for your child. You know, the mom is not going to be the only one that gets to decide if the baby is going to go on formula or if the baby is going to be exclusively breastfed. So during pregnancy, I encourage the male partner to also be involved and go to clinic visit with the mother. It will also assist or capacitate the male partner with the skills and ability to support the female partner so that the mom-to-be can have good mental health. Guys, I can never stress how significant good mental health is during pregnancy, in fact from the onset of pregnancy, because we should not try to support women at delivery because we are scared of postpartum depression. Postpartum depression is not the result of depression after giving birth, but it is the result of depression during pregnancy and after delivery. For instance, I've shared that I've had my own share of postpartum blues, and I think mine were caused more about the experiences that I had during my pregnancy. So if you've got a partner that goes to the clinics with you or goes to the doctor with you, the doctor can best capacitate this partner to be able to support the mother during pregnancy, and that is good for the mother's mental health, and it will also reduce the chances of the mother having postpartum blues or postpartum depression. And I would highly recommend Mom Connect. It is also going to be recommended to you by your clinical healthcare workers, like your nurses and your doctors. I don't know if doctors do recommend it. Mom Connect is basically an app that you can download on your phone, and your healthcare worker can register you or you can register yourself. Mom Connect will constantly be sending you reminders of what you need to be doing during each gestational age of your pregnancy. It will also remind you of your appointments. If you are pregnant, it is significant that you do not miss any appointment. Guys, there is no appointment that is not important during pregnancy. Like, even if the midwife just checks you, checks the baby and says everything is fine, that is very important, because literally it takes a second for a pregnancy to turn around and become a misery. So do not take any appointment for granted, okay? I wish you a successful, healthy journey during your time of trying to conceive, and I hope that it's going to be stress-free, and I hope this video will assist you to make better decisions for yourself, for your unborn baby, and for your partner. If you did enjoy this video and found it informative, please do give it a massive thumbs up and comment down below. Let me know if you've got any questions that you have and you feel I did not cover in this particular video, and I will definitely answer you in the comment section. If you want to have a private chat with me, please do follow me on my social media platform at IamNessZ on Instagram, Twitter, and on Facebook. You can just search for the NessZ page and leave me a private message there. I always answer my DMs, as long as you don't start with hi and expect me to respond. You just leave me your entire whole message and then I'll get back to you. I'll see you guys on my next one. Mwah.